Bismillahirrahmanirrahim. Thank you so much for inviting me to this prestigious scientific event. And I'm extremely humbled and privileged to be in front of you all. So I'm Dr. Mian Javed Iqbal, working as Assistant Professor, Sports Orthopedics, Lady Reading Hospital, KPK, Pakistan. This is the biggest hospital of KPK. This is the hospital where I'm working. So coming to my talk, first of all, disclosure, I'm going nothing to disclose. The topic for today's talk is hamstring graft preparation technique. So the outline of my talk, I will briefly touch the basics of the graft, armamentarium required for the graft preparation, whip stitching the ends, suspensory mechanism incorporation, addition of the fiber tape, and aseptic measures to minimize the chances of infection. So you all know, just to recapitulate your knowledge, the diameter that should be equal or more than 8, and in this case, the failure chances is from 0 to 1.7%. The femoral tunnel length, the graft in the femoral tunnel, that should be minimum 15 millimeter. In the tibial tunnel, that should be minimum 15 millimeter. This is basically for all inside ACL reconstruction. So the intra-articular length, that is basically 30 millimeter. So the total length in this case comes up to 60 to 65 millimeter. This is basically for all inside ACL reconstruction. Basically, we are transportal reconstruction. We need a length up to 85 to 90 millimeter. So this is basically the whole armamentarium. So starting from the left side, this is basically ACL preparation graft board. Second one is basically the sutures to whip stitch the ends. Another bluish one is basically the ultra tape, the fiber tape, internal seat belt mechanism. The next one is basically the suspensory mechanism, that is the endo button. And the two tendons are basically harvested semity and gracilis. And in the saying that has been pre-filled antibiotic to spray on the graft, which basically gives double action, that is aseptic cover, and it keeps the graft wet. So this is basically how to clear the tendon from the muscle fibers. This is the semity tendon. And this is the simple, quick, and easy way to remove all the muscle fibers from the graft. This is the gracilis tendon, and within limited time, we can clear the graft from the muscle fibers. So the next step is basically mounting the graft on the graft preparation table. The two ends has been mounted on the graft preparation board. And now I'm going to whip stitch the end. So I will take 4 to 5 bites, non-locking manner, and I'm incorporating the outer 1/3 edge of the graft, and this is the most secured mechanism. Now the next step is basically to measure and assess the length. So the semity and the gracilis has been placed on the graft preparation board, and in this case I'm assessing the length, and the length of the semity is 280 millimeter. And this gracilis is basically up to 18 millimeter. So this is the next step. After whip stitching the ends, assessing the length. So the big issue in the hams is basically the die of the graft, which is the most important determinant of the functional outcome, whether this graft will fail or it will be taken up by the bone. So basically in this case, the graft dia was basically less, so we basically I'm deciding to make 3-fold of the semity and 2-fold of the gracilis to make and to get 5-strand graft. So this is the way. Basically, at that end, the suspensory mechanism, one end of the graft has been loosely stitched and looped with the endo button. And this is the second stitch which I am passing. And look how I am making 3 folds of the semity. The quick, easy way. But one point is that with the suspensory mechanism, I am loosely tying the one end of the graft during, so that it may fix to the bone and in the socket later on during pulling from the femoral side. So again, I'm checking the length, and in this case, the length was up to 90 millimeter. That is 9 centimeter was the length. That is excellent length. We can get by this mean. So the next step is to mount and to incorporate the gracilis tendon. So adding the 2 strands of the gracilis and 3 strands of semity, we will get 5-strand graft. So in this case, the die is 8.5 millimeter and the length is 90 millimeter. So this is the next step basically to assess the die of the graft. This is 8.5 and it is, it's 9 and it's a bit loose, and this one is 8.5 and it's snugly fitting into the sizer. This is basically the fiber tape, the ultra tape, internal seat belt to give extra strength to the graft and to prevent the graft from any trauma re-rupture during rehabilitation phase. This is the final look. The graft is lying in the graft cradle. There is antibiotic has been sprayed on the graft, and it will minimize the chance of infection, preventing the graft from drying. This is the ultra tape. One end to one end suspension mechanism has been attached, and the graft is otherwise ready to be incorporated in the knee. These are the references. Thank you so much.